Hi everyone, my name is Dinh, and today I'll be presenting my community house project on Coweta County, Georgia. I'm a psychology major at the University of West Georgia. I saw Coweta County, especially Newnan, because I actually live in here. I want to better understand my community and how different social, community, and environmental factors affect people's health and daily life. Since I live in this area, I've seen how community has been growing quickly, especially with more houses and more business being built. That made me curious about how these changes actually affect people's daily lives and health. Coweta County is located in west central Georgia and is the part of Atlanta metropolitan area. The area has been growing quickly as more people move into suburban communities. I personally noticed that more people are moving here and traffic has increased compared to before, which shows how fast the area is developing. The county was established in 1826 and was originally based on agriculture. Over time, it has developed into a suburban area while still maintaining some of its historical characters. The population is about 150,000 with an average age around 39. Most households have about 2 to 3 people, which shows a stable working population. From my experience, I see a lot of families and working adults in this area, which match the data showing a stable working age population. The median household income is around $92,000, which is higher than the state average. However, about 11% of people still live below the poverty line, which shows that inequality still exists and challenges minority groups. Even though the average income is high, I still see the areas where people live might struggle more, which reflects the income inequality mentioned in the data. There are hospitals and public health services available. For example, Diamond Union Hospital, but about 11% of residents are uninsured, which may limit access to healthcare services. In my experience, healthcare facilities are available, but I know that not everyone can easily access them, especially if they don't have insurance. Education levels are relatively high, which helps people have better job opportunities in the future. It's very good because our kids will have a good school and they will have a good opportunity in the future. So they might have a good life in the future. And you can see The percent of high school graduate is kind of high, with 92, almost 93%, 37 bachelor degrees. I think it's pretty good, and I really love that data. How education improve the community? You can see, if we have the high education, we will have the better job in the future. One major issue is transportation. Most people depend on cars because public transportation is limited. This can be harder for some people, especially older people, to access healthcare and jobs. This is something I personally experience. Having a car is almost necessary here. Without a car, it could be really hard or difficult to go to work or play at school or even grocery store. So I hope in the future they will have more transportation available for everyone, especially for older people and for kids. Housing costs have been increasingly, which can create financial stress. This means people might have less chance to buy their houses and other basic needs. I also noticed that new houses and apartments are being built, but prices are going up, which can make it harder for some people to afford living here. And especially for minority groups, they might don't have any chance to access to to access buy a house or apartment. The crime rate is moderate, mostly properly crime. Even if it's not very dangerous, the fear of crime can still affect. Therefore, it can increase stress and anxiety, reduce outdoor activity. Life expectancy is around 76 to 77 years, similar to national average, but it depends on factors like income, healthcare, and living conditions. Also about lifestyle behavior. For my walkability assessment, I explore Peachtree Lake. The area is very clean, safe, and enjoyable for walking. However, it's not practical for daily needs, so people still rely on car. And you can see the walk score is about 55. It's fairly walkable, but not a bad score. But you can see from my picture, is very beautiful place. Would have a lot of trees, lake, and so beautiful. The road is very clean and well maintained environment. So I encourage you should go to that place because it's very perfect for me. And if you go with your family or your friend, it is more perfect. As a future psychologist, this project helped me understand how environment and social factors affect mental and physical health. It also helped me build my skill like observation, data interpretation, critical thinking, cultural awareness. and other skills to help me understand different communities. This project also helped me understand that when working as a psychologist, I need to consider not just the person, but also their environment and background. Overall, I learned that health is influenced by more than just healthcare. Factors like transportation, housing, and environment all play a role. One thing that really stood out to me was how something simple like transportation can affect access to healthcare and daily life. And also what surprised me most was how transportation affect to healthcare. I really appreciate you listening and I hope you love my presentation. This is my reference and all the sources I gave you information. I really appreciate you listening my presentation and I hope you love it. Time to say goodbye. Bye.